Right, you're welcome back to Morning Delight, and of course this is the Open Access segment. On this segment we have this particular part where we will be continuing the conversations we started last week, if you were with us, where we had a conversation about breastfeeding babies, especially during this pandemic of COVID-19. Of course, we have a follow-up this morning with another interesting guest, of course, with our partners Alive and Thrive, and they're here to talk about maternal and infant nutrition. And today we'll be looking at the role of gatekeepers in the community. Who exactly are these gatekeepers? I saw the name, I was like, okay, I need to also find out. So if you're a mother, if you're a father, if you have babies, of course, this is the show for you to watch at this time when you know you're breastfeeding your child or you're even providing any form of nutrition for your children and they're so dependent on you. So let's meet our guest. She is Rashida Sani Afolabi. She is a health educator and she's here to tell us more about the role of gatekeepers in maternal feeding and nutrition, maternal and infant nutrition. You're welcome to the show.
Thank you for joining
Good to have
us.
you.
Thank you.
All right, when I saw community gatekeepers, I quickly said to the producer, please, what is this now? All right, so please tell us who community gatekeepers are and why exactly should we be talking about them and looking at them at this point?
Okay, basically, community gatekeepers can be simply put as a person or a group of people who has, by virtue of their position, have a direct or indirect relationship or influence on the nutritional status of the mother, whether pregnant, the infant, as well as young children. And they include from the husband, you have the community leaders like the market leaders, a very strong force when it comes to influence on maternal and infant nutrition. We also have religious leaders, we have the traditional leaders, we have the youth leaders, as well as heads of various associations like the CDC, the CDA, and even the youths and artisan groups, and a whole lot of others. So those are the community gatekeepers and how they can have, later we'll be talking about how they can have influence on maternal and child nutrition.
Okay, so let us break it down. What exactly are they expected to do? What are their roles? What are they expected to do? We hear maybe the husband, you know, he's always by the wife and all that. All other people, what are they expected to do?
Yeah, let's start from the husband, like you said. Basically, their roles is more of supportive as well as being exemplary. For instance, for the man, the husband, for a woman to breastfeed exclusively or whether from pregnancy, in terms of having to go to antenatal, there must be someone to support her, to encourage her, to make it easy for her to go through the process of pregnancy, delivery, as well as lactation. So for the other group of people I mentioned, you have like the market group, the in-laws that are right there, whether the mother-in-law or father-in-law as it were. Most times they have an influence. They want to tell you, oh, if it happens that they breastfed their baby, for instance, they can tell you that this is the way we do it.
Okay, share experiences.
For the religious leaders, for instance, you know, the position in which they hold has made it easy for them that when they talk to their congregation, people listen. The same thing with the traditional leaders. The youths are there. If they're able to have a first-hand information as to if they're well convinced about the importance of maternal, infant, and young child nutrition, they will also help in pushing out the information, and there will be a behavioral change communication, and of course, we'll be better for it.
All right. In terms of keeping safe, we're talking about preventive measures. So if the mother knows what she's supposed to do, how should these community gatekeepers also help to ensure that at least these preventive measures are strictly followed?
Okay, for the community gatekeepers, another thing they can do is in terms of having to collaborate. There must be effective collaboration between this group of people I've mentioned and the health system. For instance, the primary health care department is the closest to the grassroots, to the people. So there's a collaboration with the community gatekeepers and the healthcare system. You have this flow of information coming back and forth. There is feedback. For it, let's say like the religious leaders, there's what we call the social mobilization committee at the grassroots level, where various leaders, representing the various existing structures in the community, they come together to discuss best practices and get first-hand information from the healthcare workers, which they have to now disseminate to their congregation or groups in which they represent. So, for instance, in the advent of COVID-19, for bringing it down to COVID-19, we found out that the importance of nutrition cannot be overemphasized. So one needs to, as much as possible, to make sure that that pregnant woman, she has adequate nutrition. How does she know what to eat, when to eat it, and how to eat it? It means that she must go through an antenatal period, which is minimum of 4 visits, which we call focus group, focus antenatal care. So there, the healthcare workers like the nurses, the midwives, and the doctors, or those that are attending to her, they can educate her on the importance of nutrition, especially in the first 1,000 days of life, which is the most crucial period for the child. Then also, you'll be looking at early initiation. What is early initiation? If these gatekeepers are better informed, they understand the importance of that immediately the woman is put into birth, she must put the baby to breast within the first 1 hour of life. So this has its own numerous advantages in terms of control of bleeding, making lactation easy for the woman, and there's bonding. There are lots of benefits. Then she now has to go through the process of exclusively breastfeeding that baby for the first 6 months of life. All this has ways in protecting the child, so it makes the child start strong from day one. The child has all he or she needs to stand the outside world. It's a new world for the baby now, so the baby must have adequate nutrition, which will help the baby in making sure that the baby goes through that process. Then from 6 months, you now have complementary feeding. For the complementary feeding, she must be able to introduce the family foods into the nutrition.
Right. Okay, just a moment. Here we have to take a short break now.
Okay.
Viewers, we'll be right back after this break to continue the conversation on maternal and infant nutrition, especially at this time of COVID-19, the role of community gatekeepers. We'll be back. No, you're not.
First news, that first kick, that first cry, and those first moments put baby to mother's breast right away. That first yellowish milk, colostrum, has the nutrients baby needs to grow healthy, strong, and sharp. Ask your health worker to put your baby to the breast within the first hour. Start strong for a better future.
This message is from the Lagos State Government with support from Alive and Thrive and other partners.
All right, you're welcome back to Open Access and Morning Delight. And of course, we've been talking with Rasheedat Sani Afolabi, who is a health educator, who is here to tell us more, to tell us a lot more from last week about maternal and infant nutrition, especially now during the COVID-19 pandemic. And we are looking specifically at the role of community gate speakers. We're talking about the measures, and we just like Rasheedat to continue. So what are the measures do you think the community community gatekeepers should ensure for the mother and the child to also come out strong, especially at this time of the pandemic.
Okay, thank you. What other things they can do? Having gotten the information they need from the healthcare workers, it would be nice for them. Definitely, they don't have to keep the information to themselves. So they look at avenues in which they can disseminate information to their group or the various people in which they represent. There are various ways in which they can do this, depending on the group and what best suits them. So you can have like the chant criers, which the religious leaders can use. They also use the social media platforms, the various ones we have like WhatsApp and the Facebook, which is it's available, it's accessible, and interestingly, it's very acceptable even at the grassroots level. Then other ways in which you can even have a situation where a traditional leader or leader, yes, local, yes, the context. It has to be in the local content, which is acceptable by the people. And that is why it should be from them, so that there will be this sense of involvement, there's participation, and the sense of ownership. So when they know that this thing is ours, they understand the importance of nutrition. So it helps in reducing maternal morbidity and mortality. And it also helps, it's an all-encompassing thing. You look at it from the economic aspect of it, you're looking at the socio-cultural, the psychological, and even the short and long-term implication of exclusive breastfeeding. Early initiation is very important. Then dietary diversity. So when they understand those things, though, in their own way, what best suits them, to now come up with this information in collaboration with the healthcare workers. To, for instance, look at when you have like a banner strategically located maybe in front of a church or in the market arena, and there's this woman breastfeeding her baby with a smiling face. She's looking very relaxed. The husband is right there, probably just giving her a pat on the back. You know, it shows an holistic picture of what a happy family and a healthy family should look like, or a pregnant woman going to
Should that picture only always be in the picture? The husband patting the woman on the back?
No, it's not necessarily.
Usually when I get to the church, I should see the man patting the woman on the back.
I'm not saying, for instance.
What message do we now have for the men? How involved and how inclusive are we bringing the men on board when it comes to breastfeeding? Male involvement is very, very important. And that was why when I mentioned who the gatekeepers were or are, I started from the home, which is the man. If the man has, if he understands the importance of maternal, infant, and young child nutrition, he will give the wife absolute support. So when the support is coming from the man, from day one, even before she gets pregnant, she should be able to know, he understands that, oh, what do we need to do before she's pregnant, so that there's what we call barrier anemia, this anemic level where most people, they just get pregnant, not even know they're anemic. But when they know their level, their nutritional status, they can know how to boost it. They will understand the importance of adequate nutrition, vitamins and minerals, so that when she's eating, the man won't be like, are you the only one that is pregnant? Are you the first person that will be pregnant? But he will be able to support her and support. And when she says she wants to breastfeed exclusively, you understand the importance that, oh, they've told us at the ANC that the baby does not need water in the first 6 months of life. It won't say, the baby is thirsty, this woman, maybe you are not a nice, I don't understand you. So by then, it makes it easy for him to support him. Even when the in-laws come, the mother-in-law come and say, no, this child is thirsty, he will be able to even convince his own mother that, this is the best way to go. These are the reasons, these are the benefits. So there's this synergy and collaboration, and the woman will be able to go through that process. And even when the child starts complementary feeding from 6 months, you won't have this idea of, she should go and, the baby has started working now, you should start having another baby now. You know what, the way it goes. But if he understands the dynamics, he understands that the narrative needs to change, and it has to start from him as a partner. Right. So, and that goes out either to the traditional leaders, youth leaders. They'll be the ones to push the information, and with that, we can have a sustainable system.
Okay, we're talking good nutrition here. How can it be sustained? You know, through the different levels. You know, how can good nutrition be sustained, especially for the children?
Like I said, if you start from the home, before antenatal, the woman already knows what she needs to do. So psychologically, she's prepared. It's not easy to go through exclusive breastfeeding. You have to.
Yeah, from then on, we've talked about the children.
Sustainability, what you now have to do from 6 months, when the baby has to start taking the home food, you now have to still continue exclusively breastfeeding. Sorry, you now do complementary feeding. she'll still be breastfeeding, but she will not be taking the home food up to when the child is 2 years of age.
Okay.
And by the time the community gatekeepers, and that's why they are very important, when everybody knows the importance of breastfeeding and the maternal health, she's hearing here, the information is going in different fora. So you have this barrier change communication, which of course is not a one-off thing, it's a process. So the more she gets to know about it, it makes it easy for sustainability of the nutritional status of the woman and the child.
All right, let's talk. We can't talk about this without talking about cultural practices. I mean, we're a highly cultured society, and there's so many practices we grew up with that we had to shed over time, especially with the breastfeeding and water, breastfeeding with formula and all. What are some of these practices that we need to totally eradicate, and what are some that we can use as we keep going on complementarily that will lead to the success of the woman and the child?
Well, for the good practices, it still boils down to exclusive breastfeeding because it's part of our culture. So we must promote it. And then also the use of our advisor, we should continue the use of our local foods. We should go more on our local foods rather than processed meals for this group of people, especially the children under the age of 2. Then for the practices that are negative, cultural practices, I think for this group of people, a pregnant woman, an infant or a child, we should, as much as possible, discourage the use of alcohol. You'll be amazed. From my interaction with the community, even during this COVID-19 pandemic, I've met 1 or 2 people where, as a pregnant woman, actually consuming alcohol with the impression that it will protect our child and ourselves from COVID-19, which is not true. So we must be able to change the narrative and make them understand that this is not acceptable and is not healthy for either ourselves or the baby which she's carrying.
Okay.
All right. Just 1 minute. So a viewer has sent a message. She has a daughter who is 6 months plus, and she did exclusive. Right now, she's refusing to take water from her. She keeps spitting the water out, and she says she's worried. What should she do?
Basically, she needs to encourage. I wouldn't know if she has started at 6 months. It's not likely that the child will stop, because I also exclusively breastfed my child, even despite the fact I had a cesarean section, which is not a contraindication as to what people think that if you have a CS, you can exclusive breastfeed your baby. Is not true. But she needs to persevere. But I would advise her to go to the nearest primary health care center. We'll meet the healthcare workers. We'll be able to assist her accordingly.
Right. We want to thank you so much, Rashida Sania Falabi, for coming on the show today and to educate us more. And we do hope at least to learn more from your organization as we continue to go.
Thank you very much.
All right, Adetola?
Yes, okay, then we'll take another